This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
A brighter future, declining mother and child mortality rates in Nigeria. For years, Nigeria grappled with high maternal and child mortality rates, earning it one of the most alarming statistics globally. However, recent developments have brought a glimmer of hope. Thanks to concerted efforts by the government, healthcare professionals, and international partners, Nigeria is witnessing a significant decline in these once daunting figures. In 2010, Nigeria's maternal mortality ratio stood at an alarming 814 deaths per 100,000 live births. By 2023, this figure had dropped to 512 deaths per 100,000 live births, according to the National Bureau of Statistics. Similarly, under-5 child mortality rates declined from 157 deaths per 1,000 live births in 2010 to 100 deaths per 1,000 live births in 2023. While these numbers are still high compared to global averages, the downward trend signifies progress. Improved access to healthcare. The government's commitment to building and renovating primary healthcare centers across the country has been instrumental. Over 10,000 PHCs were refurbished under the Basic Healthcare Provision Fund initiative, ensuring that even remote communities could access quality care. For instance, in Kano State, the reopening of community health clinics reduced maternal deaths by 40% between 2020 and 2023. Training and deployment of skilled birth attendants. Recognizing the importance of skilled care during childbirth, Nigeria launched programs to train and deploy midwives to underserved areas. The Midwives Service Scheme alone contributed to a 20% reduction in maternal deaths in rural areas. Women like Hawa Ibrahim, a midwife in Sokoto, have shared stories of saving lives through timely interventions during complications. Immunization campaigns. Nationwide immunization drives targeting preventable diseases like measles, polio, and pneumonia have drastically reduced child mortality. The National Routine Immunization Strengthening Project, supported by Gavi, the Vaccine Alliance, increased vaccination coverage from 33% in 2016 to over 70% by 2023. Health education and family planning. Community-based programs, educating women about prenatal care, nutrition, and family planning have empowered mothers to make informed decisions. In Lagos State, the Mama Care initiative reached over 500,000 women with critical health information, leading to healthier pregnancies and safer deliveries. Emergency transport systems. Innovations like the Saving 1 Million Lives project introduced emergency transport schemes to ferry pregnant women to hospitals during labor. In Nasarawa State, the deployment of ambulance bikes reduced maternal deaths in hard-to-reach areas by 30% within 2 years. Mariam Abdullahi, a mother of 3 from Kaduna, shared her experience. During my first pregnancy, there was no clinic nearby. I lost my baby, but with the new health center in our community, I delivered my last 2 children safely with the help of skilled nurses. Similarly, in Ogun State, 5-year-old Emeka survived a severe bout of pneumonia thanks to the availability of vaccines and antibiotics at his local PHC. We never thought he'd make it, his mother said, but the doctors and nurses gave us hope. This progress is the result of collaboration between multiple stakeholders. International organizations like UNICEF, WHO, and USAID have provided funding and technical support, while local NGOs and community leaders have ensured grassroots engagement. While the strides are commendable, challenges remain. Investments in healthcare infrastructure, staff training, and public awareness must continue to sustain and accelerate progress. The goal is clear: to meet the United Nations Sustainable Development Goal of reducing maternal mortality to fewer than 70 deaths per 100,000 live births and ending preventable child deaths by 2030. For Nigeria, the declining maternal and child mortality rates signify not just numbers, but the preservation of lives and futures. It's a testament to the resilience and potential of a nation determined to secure a healthier tomorrow for its mothers and children.